Welcome to the SABC News COVID-19 Global Wrap. I am Busisiwa Khadebe. This week, I bring you highlights of news which dominated headlines with regards to the coronavirus pandemic. But before we delve into it, let us have a look at some global stats. The world currently has over 139 million cases, over 118 million recoveries, and has now surpassed 3 million deaths. South Africa has 1,562,931 cases, with 1,488,060 recoveries and 53,571 deaths. Staying in South Africa, in a surprise move this week, Health Minister Dr. Zweli Mkhize told Parliament that Johnson & Johnson is refusing to sign off the supply of a further 20 million doses of the COVID-19 vaccine unless it receives a letter from the Department of Trade and Industry endorsing the local investment it has made in Aspen Pharmaceuticals. Mkhize says such support is already part of the agreement and has been publicly stated. He says this is only one of the many hurdles they have had to deal with as they try to secure vaccines for the country. Meanwhile, the Health Ministry has called on the public not to panic following the announcement that the rollout of the Johnson & Johnson has been suspended in South Africa, saying the issue will be cleared in a few days. The temporary suspension of the rollout comes after the U.S. Food and Drug Administration reported that 6 cases of blood clotting were detected following the rollout of more than 6.8 million doses of the vaccine. The South African Medical Association has welcomed Minister Mkhize's decision to temporarily halt the rollout while investigations into reports of red blood clotting continue. And lastly, the South African Health Products Regulatory Authority says it will continue evaluating the safety and watching world developments regarding the Johnson & Johnson COVID-19 vaccine. The continent has now recorded over 4.4 million confirmed COVID-19 cases with over 3.9 million recoveries, and the death toll stands at 117,363. The head of Africa CDC, John Kengasong, says many Africans who have received their first COVID-19 vaccine do not know when they will get a second shot because deliveries are delayed. According to Africa CDC, Africa lags behind most other regions in COVID-19 vaccinations, with just less than 14 million doses having been administered on the continent of 1.3 billion. And in international news, the United States has once again criticized China's handling of COVID-19, saying the East Asian country did not give access to international experts or share information in real time to provide true transparency. State Secretary Anthony Blinken says that failure to provide access to global health experts made the COVID-19 pandemic worse than it had to be, adding that it's important to get to the bottom of the novel coronavirus. The US, which is the world's worst affected country by COVID-19, has seen rising cases and hospitalizations for 2 weeks in a row. In the week ended April the 11th, Michigan reported the highest number of new cases per capita of all 50 states and also led the country in hospitalizations per capita. Around 39% of new cases in Michigan were of the more contagious B.1.1.7 variant of the virus first identified in the United Kingdom. In South America, a study has shown that Brazil's P1 COVID-19 variant is mutating and may become more dangerous. Research conducted by the Public Health Institute Fiocruz into the variants circulating in Brazil found mutations in the spike region of the virus that is used to enter and infect cells, and scientists say these changes could make the virus more resistant to vaccines. Studies have shown the P1 variant to be as much as 2.5 times more contagious than the original coronavirus and more resistant to antibodies. In Asia, an expert panel of India's drugs regulator has recommended emergency use approval of Russia's Sputnik V coronavirus vaccine as infections surge again. As it battles a massive second wave, India overtook Brazil to become the nation with the second highest number of infections worldwide after the United States. And in Hong Kong, authorities said on Thursday the city's vaccine scheme would be widened to include those aged between 16 and 29 for the first time as they aim to boost demand for inoculations in the Asian financial hub. In Europe, a report from the IFA National Pharmaceutical Agency indicates that 4 people died in Italy from rare blood clots after they received the AstraZeneca COVID-19 vaccine. Like many European countries, Italy briefly halted AstraZeneca inoculations last month when blood clot concerns surfaced, but has since resumed them for those aged 60 and above after European Union regulators said the benefits outweighed the risks. Meanwhile, the largest surge testing operation to date in some parts of London is underway. This comes after a sudden increase in the number of people testing positive for the COVID-19 variant first detected in South Africa. 44 cases of the COVID-19 variant have now been confirmed in 2 areas of South London, namely Lambeth and Wandsworth, while a further 33 people are also suspected to have that variant. And finally, evangelical leader Reverend Tony Spell preached a different message during his sermon this past Sunday, urging his congregants not to trust COVID-19 vaccines. As seen in a CNN report, Spell is among some evangelical Christians who have vehemently remained opposed to getting vaccinated for COVID-19. For the latest updates on the coronavirus, visit sabcnews.com.